3. Dr. Kristen Simpson with Simpson Dental Associates joins us now to maybe take some of your calls. If you got a question about your teeth, you can call the number right there on your screen. It's 1-877-924-7888. Dr. Kristen Simpson also back from Peru.
Yes.
What were you doing in Peru?
Oh, went to hike the Inca Trail.
So what was that like?
It was a great experience. It was tough, but rewarding at the same time.
You also lost your phone down there.
Yes, lost my phone.
Not
Gotta
good.
be careful when you travel.
Okay, so what were their teeth like down there?
You know, they did need a lot of dental work. It is a third world country, so they have very rural areas there that they can't really have access to dental care. So it's kind of like some of the rural areas here in West Virginia, too. So it's just focusing on education is very important for areas like that.
Absolutely.
Yes.
Good dental hygiene, very important stuff.
Yes.
All right, well, let's talk a little bit back to business here. Okay, so you
Okay.
guys offer teeth whitening.
We do.
What are some of the options that people have for that?
Okay, well,
With
some of the
Simpson
options
Dental
are,
Associates.
yes, you can have impressions made and have like take-home trays made. This doesn't really work as well as the in-office whitening. The in-office whitening called Zoom is what we use.
Okay.
And what we do is we isolate the teeth. So we basically cover up all the gum tissues in your cheeks so that the whitening gel just touches the teeth. And we do 3 cycles of 15 minutes with the whitening gel. During the cycles, we'll check to make sure that you don't have any of the side effects. And really, the only side effects of whitening is sensitivity. So, as long as you're not getting any sensitivity, we can do all 3 cycles. And then we also make the impressions to be able to give you the take-home trays so that you can maintain the shade that you get while you're in the office. So normally people get really good results with the in-office whitening.
Okay. Well, your teeth are white. They look great.
Thank you. Yes, and I've had it done.
Okay,
So,
let's go to the phone lines. Let's open the phone lines up. We've got Carrie. Carrie,
Okay.
good morning. What's your question for Dr. Simpson?
Good morning. My mother is she's 80, like 85 plus, and she's been a vegetarian most of her life.
Okay.
And at one time she was a vegan, but now she takes vitamins and she's the dentist and doctor regularly. But I was wondering, she's been having teeth loss. She's lost like 4 teeth. It seems like just all at once. Now, does that have anything to do with her diet?
Well, really the only thing in your diet would be if you have lots of sugar that is on your teeth that could, make them more susceptible to cavities, or if she's had changes in her medications where she might have decreased salivary flow, that could be something that could have increased the cavity production. But a lot of times once you've had wear on teeth and that wear's gone through the enamel and into the dentin, then you can start to see the teeth break down pretty quickly. So if it's something where she might not have seen a dentist for a while and not have known that this was going on, it might happen all of a sudden. You see the teeth breaking down. So it is important to keep up with regular visits to catch these things early.
That's a good question.
That is, yes.
All right, so let's talk a little bit about if I have a tooth
Yes.
that needs a crown.
Yes.
Actually, let's go back to the phones. We've got
Okay,
Lucille.
sure.
Lucille, good
Yes.
morning. What's your question for the doctor?
Yes, I would like to know if I could do whitening strips on my dentures.
Well, dentures are like a plastic material, so really they don't whiten with whitening strips. You can use, just brushing them and using the Polydent or Efferdent like tablets to be able to get the staining out of the dentures. But if there's too much staining in them, it could be that the acrylic is just going bad in them. Dentures are only good for
Actually, I have a
5
question
years.
about that, to kind of follow up
Sure.
with that. Could you take like a whitening rinse and soak your dentures in that? Is that a good idea or is that a bad idea? Is that something?
I mean, you could try it. You probably wouldn't get much results from it because that acrylic, once it starts to stain and takes on those stains, really the best thing to do is having your dentures made.
Sure.
You really should have new dentures made every 3 to 5 years anyways because your tissues underneath change and you want the dentures to fit well. So that would be something to keep in mind.
All right, we have another question from Robin. Robin,
Okay,
good morning. What's your question for Dr. Simpson?
Yes, my teeth are bonded, and I was wondering if there's anything that I could get over the counter to whiten.
Okay, well, with bonding, the bonding is a composite material, so that material doesn't really whiten. You can sometimes polish it professionally in the dental office when you have like your teeth cleaned, but if you've had your teeth whitened and you want that bonding to match the whitening, you'd have to have it replaced to be able to match to the shade of the whitening, because it is, once again, a plastic material. It takes on stains and can change in color over time, so it just really needs to be replaced.
All right.
Yes.
Do we have any more callers? All right. Well, I think we don't have any more callers, but Dr.
Okay.
Krista Simpson, back from Peru.
Back,
Had
yes.
a great time
I
answering your
did.
questions.
Yes.
Had some great questions today.
We did.
See you next week.
Okay.
Stick around. There's more news right here on